So there are two types of blood vessels in the brain, broadly speaking. One are small blood vessels and one are large blood vessels. So when these large blood vessels gets blocked, they usually tend to have very catastrophic effect on the patients who suffer from such stroke, and these strokes are called large vessel occlusion strokes, and usually has a mortality rate of 20 to 30% and a very long-term disability rate of 60 to 90%. So the modern treatment of these strokes are to bring out the clots inside the brain which are blocking these sort of arteries. So if we want to take out these clots from inside the brain, we will require devices. So the devices were there, but what we found out was there is a huge disparity in the availability of such treatment across the masses. Like somebody from the US is more likely to get this sort of therapy rather than somebody living in India, just because of the significant cost disparity and the availability of such therapy across the spectrum of India versus across the spectrum of US versus the spectrum of China, let's say, as a neighboring country. So our emphasis, the whole motto of the grassroots trial was to bring out such a device which can be made available to the needy patients in hours of crisis in a cost which would be very affordable without compromising on the quality and the efficacy of the device. So that was the challenge.